As long distance runners and elite athletes, we tend to toe a fine line between peak performance before a competition and burnout or injury. Plantar fasciitis, IT band pain, hip pain, knee pain, or low back pain are all things that can be helped with specific chiropractic care in the acute condition, as well as in the long term for creating balance within the entire pelvis and as a preventative measure for maintaining and increasing your body's ability to adapt to the everyday stresses of running. When a distance runner first comes into my office for a new patient exam, I like to let them know that as chiropractors, our job is to locate specific areas of your spine, pelvis, and any other joint in your body that might not be moving properly. If we can address the specific dysfunction, restore proper function to the body, ultimately your body is going to be able to better adapt to the stresses of running. But what I love most is when we start to talk about the long-term benefits of chiropractic care for distance runners in creating balance within the entire body. I love to use this biotensegrity model of the pelvis. So biotensegrity is our new age thinking of how the body works. So we don't think of the body as just a stack of bricks anymore. We know that everything is intertwined and interconnected throughout the entire system. And so if we look at our biotensegrity model of the pelvis, we can think of the wooden struts here as the bones, and the ligaments and tendons and muscles would represent the rubber bands. And so as runners, we're really focused on wanting to have a strong, stable, and balanced pelvis. So if you have some sort of imbalance or rotation or fixation or distortion within your pelvis, you can see how some areas of the structure are more tensed and some are more compressed. And so you have this distortion pattern within your entire pelvis. And then if you have that unleveling, that imbalance within your body, and then you imagine running 80 to 90 steps per minute per foot, eventually that's going to lead to some type of compensation injury over time. So whether we have plantar fasciitis, knee pain, IT band pain, lower back, or anything, if we're not having a structural base as we're on one foot while we're running, the body's going to compensate in one way or the other. And so as chiropractors, our job is to figure out what is going on with your pelvis, how can we find a way to take you from a state of distortion to complete ease. Knowing that if your body can stay in more of a balanced, ideal functional state, then you're going to be better able to adapt to the stresses of running when you're out on your trails, on the track, or on the road. I hope this provided with you a simple and easy to understand explanation of how chiropractic care can help you when you have acute pain symptoms to help you restore balance within your entire body and as a preventative measure for helping you create a more adaptive body to the everyday stresses of distance running. If you have any more questions about how chiropractic care might be able to help you, or if you know somebody who's riding that fine line and tends to go back to the areas of pushing themselves where they're hurt and in pain and not able to run, please tag your friend. I look forward to helping you out.